Question 1. A nurse is preparing to administer medications to a client. Which actions demonstrate adherence to the rights of medication administration? Select all that apply. A. Administering a medication 30 minutes before the scheduled time. B. Checking the client's identification band against the medication administration record, MAR. C. Documenting the medication administration after the shift ends. D. Educating the client about the medication's purpose and side effects. E. Verifying the medication dosage calculation with another nurse. F. Administering a PRN pain medication when the client denies pain but is scheduled for it. Answer. Checking the client's identification band against the medication administration record, MAR, educating the client about the medication's purpose and side effects, verifying the medication dosage calculation with another nurse. This question tests the foundational rights of medication administration, crucial for client safety. Adherence involves confirming the right client using two identifiers, providing the right education, and ensuring the right dose through verification, especially for high-alert medications or complex calculations. For example, a nurse always scans the client's wristband and asks their name before giving medication, then explains what they are taking. Remember, these rights are a safety net to prevent errors and ensure effective, client-centered care. Question 2. The nurse is caring for a client with fluid volume excess. Which clinical manifestations would the nurse expect to assess? Select all that apply. A. Orthostatic hypotension. B. Bounding pulse. C. Decreased urine output. D. Jugular venous distension, JVD. E. Dry mucous membranes. F. Crackles in the lungs. Answer. Bounding pulse, jugular venous distension, JVD, crackles in the lungs. This question assesses understanding of the signs and symptoms associated with fluid volume excess, often termed hypervolemia. Key indicators of too much fluid include an increased circulating volume causing a strong, bounding pulse, visible distension of the jugular veins due to elevated central venous pressure, and fluid accumulation in the lungs manifesting as crackles. For instance, a client with heart failure often exhibits these exact findings due to the body retaining excess fluid. Always remember that too much fluid will show up as visible swelling, increased pressure, and fluid sounds in the lungs. Question 3. A client is prescribed airborne precautions. Which actions should the nurse implement? Select all that apply. A. Place the client in a private room with negative air pressure. B. Wear a surgical mask when entering the client's room. C. Instruct the client to wear a mask when leaving the room for essential tests. D. Keep the client's door open to allow for air circulation. E. Use an N95 respirator mask when providing direct client care. F. Ensure visitors remain at least 3 feet from the client. Answer. Place the client in a private room with negative air pressure. Instruct the client to wear a mask when leaving the room for essential tests. Use an N95 respirator mask when providing direct client care. This question focuses on the specific infection control measures for airborne precautions, vital for preventing the spread of diseases like tuberculosis or measles. Airborne transmission requires a private, negative pressure room to contain infectious particles, and healthcare providers must wear an N95 respirator to filter these tiny particles. If the client must leave the room, they should wear a surgical mask to prevent exhaling infectious droplets into the environment. Think of airborne precautions as needing specialized masks and air systems because the germs float freely in the air. Question 4. The nurse is educating a client about measures to prevent deep vein thrombosis, DVT, after surgery. Which instructions should the nurse include? Select all that apply. A. Keep legs elevated while resting. B. Avoid ambulation for the first 24 hours post-op. C. Perform leg exercises like ankle pumps frequently. D. Maintain adequate hydration by drinking plenty of fluids. E. Wear sequential compression devices, SCDs, as prescribed. F. Limit dietary fiber to prevent straining. Answer. Keep legs elevated while resting, perform leg exercises like ankle pumps frequently, maintain adequate hydration by drinking plenty of fluids, wear sequential compression devices, SCDs, as prescribed. This question addresses crucial nursing interventions for DVT prevention in postoperative clients, emphasizing mobility and hydration. Elevating the legs promotes venous return, while frequent leg exercises like ankle pumps stimulate calf muscle contraction, both of which reduce venous stasis. Maintaining hydration prevents blood viscosity, and wearing sequential compression devices mechanically aids circulation. For example, a client recovering from knee surgery should regularly do ankle circles and keep their legs slightly raised to keep blood flowing. Remember, the goal is to keep blood from pooling and becoming thick, which can lead to clots. Question 5. A nurse is assessing a client for signs of hypokalemia. Which findings would indicate a low potassium level? Select all that apply. A. Muscle weakness and cramps. B. Peak T waves on ECG. C. Decreased bowel sounds. D. Irregular, weak pulse. E. Paresthesias, tingling or numbness. F. Diarrhea. Answer. Muscle weakness and cramps, decreased bowel sounds, irregular, weak pulse, paresthesias, tingling or numbness. This question tests recognition of the clinical manifestations of hypokalemia, a low serum potassium level, which profoundly affects muscle and nerve function. Key findings include generalized muscle weakness, decreased or absent bowel sounds due to reduced smooth muscle activity, an irregular and weak pulse from cardiac muscle irritability, and paresthesias like tingling or numbness. For instance, a client with severe vomiting might complain of profound leg weakness and have a very slow gut. When potassium is low, think slow and weak for muscles, including the heart and gut. Question 6. The nurse is caring for a client experiencing an anaphylactic reaction. Which immediate nursing interventions are appropriate? Select all that apply. A. Administer epinephrine intramuscularly. B. Elevate the client's legs if blood pressure is low. C. Administer oxygen via non-rebreather mask. D. Obtain an arterial blood gas, ABG, immediately. E. Prepare for intubation if respiratory distress worsens. F. Administer 4-diphenhydramine. Answer. Administer epinephrine intramuscularly, elevate the client's legs if blood pressure is low, administer oxygen via non-rebreather mask, prepare for intubation if respiratory distress worsens, administer 4-diphenhydramine. This question addresses the critical, immediate nursing actions for managing an anaphylactic reaction, a severe, life-threatening allergic response. The priority is to administer intramuscular epinephrine to reverse bronchospasm and hypotension, provide high-flow oxygen, elevate the client's legs to improve venous return if hypotensive, and administer antihistamines like diphenhydramine to block histamine release. Preparing for intubation is crucial for worsening respiratory distress. Consider a client who suddenly develops hives, wheezing, and drops their blood pressure after a medication. These steps are rapidly implemented to save their life. Always think ABCDE, airway, breathing, circulation, disability, exposure/epinephrine, in emergencies. Question 7. The nurse is caring for a client with a nasogastric (NG) tube connected to low intermittent suction. Which assessments are essential for the nurse to perform regularly? Select all that apply. A. Auscultate bowel sounds in all 4 quadrants. B. Check for placement of the NG tube. C. Assess the client's pain level hourly. D. Monitor intake and output. E. Observe character and amount of NG drainage. E. Assess for signs of electrolyte imbalance. Answer. Auscultate bowel sounds in all 4 quadrants, check for placement of the NG tube, monitor intake and output, observe character and amount of NG drainage, assess for signs of electrolyte imbalance. This question highlights the critical assessments required for a client with an NG tube on suction, focusing on ensuring proper function, fluid balance, and preventing complications. Regular assessment of tube placement prevents aspiration, monitoring intake and output tracks fluid balance, observing drainage provides clues about gastrointestinal status, and assessing bowel sounds indicates gut motility. Furthermore, continuous suction can lead to significant electrolyte loss, necessitating close monitoring for imbalances. For example, a client with an NG tube for bowel obstruction needs frequent checks to ensure the tube is working and not causing electrolyte issues. Remember to think comprehensively about the tube's purpose and potential consequences. Question 8. A nurse is teaching a client with newly diagnosed hypertension about lifestyle modifications. Which dietary changes should the nurse recommend? Select all that apply. A. Increase intake of processed foods. B. Limit consumption of high-sodium foods. C. Choose lean protein sources over red meat. D. Incorporate more fruits and vegetables. E. Reduce intake of saturated and trans fats. E. Consume alcoholic beverages freely. Answer. Limit consumption of high-sodium foods, choose lean protein sources over red meat, incorporate more fruits and vegetables, reduce intake of saturated and trans fats. This question focuses on essential dietary modifications for managing hypertension, emphasizing a heart-healthy approach. Limiting sodium helps reduce fluid retention and blood pressure, while choosing lean proteins and reducing saturated/trans fats lowers cholesterol and promotes cardiovascular health. Increasing fruits and vegetables provides essential nutrients and fiber, which also support blood pressure control. For example, advising a client to choose grilled chicken over fried, and snacking on an apple instead of chips, directly supports these goals. The core principle is to reduce items that stress the heart and vessels, and increase those that support their health. Question 9. The nurse is assessing a client for signs of increased intracranial pressure, ICP. Which findings would indicate an elevation in ICP? Select all that apply. A. Bradycardia. B. Hypertension with widening pulse pressure. C. Pupillary constriction. D. Headache, especially worse in the morning. E. Increased level of consciousness. E. Vomiting without nausea. Answer. Bradycardia, hypertension with widening pulse pressure, headache, especially worse in the morning, vomiting without nausea. This question tests recognition of classic signs of increased intracranial pressure, a serious neurological condition. Key indicators, collectively known as Cushing's triad, include bradycardia, slow heart rate, and hypertension with a widening pulse pressure, which reflect the body's attempt to maintain cerebral perfusion. Other signs are a persistent headache, often worse in the morning, and projectile vomiting without preceding nausea, both due to pressure on brain structures. For instance, a client who experienced a head injury might exhibit these changes, indicating a worsening condition requiring immediate intervention. Always connect these signs to the brain being compressed and losing its normal function. Question 10. A nurse is preparing to administer an intravenous, 4, push medication. Which actions are appropriate? Select all that apply. A. Aspirate for blood return before administering the medication. B. Inject the medication as rapidly as possible to ensure quick effect. C. Dilute the medication in 10 milliliters of sterile water for injection. D. Cleanse the injection port with an antiseptic wipe. E. Check for medication compatibility with the 4 fluid. F. Flush the 4 line with saline before and after administration. Answer. Aspirate for blood return before administering the medication, cleanse the injection port with an antiseptic wipe, check for medication compatibility with the 4 fluid, flush the 4 line with saline before and after administration. This question addresses the critical steps for safe intravenous push medication administration, ensuring proper delivery and preventing complications. Aspiration for blood return confirms 4 patency, cleansing the port prevents infection, and checking compatibility avoids precipitation or inactivation of medications. Flushing the line before and after ensures the medication reaches the bloodstream and clears any residual drug. For example, before pushing a diuretic, the nurse would ensure the 4 is patent, swap the port, check for compatibility with maintenance fluids, and then flush. Always remember that 4 push medications require meticulous attention to detail to protect the client. Question 11. The nurse is performing wound care for a client with a pressure injury. Which actions demonstrate appropriate technique? Select all that apply. A. Cleanse the wound with vigorous scrubbing. B. Wear clean gloves for initial assessment and then sterile gloves for dressing application. C. Irrigate the wound with normal saline. D. Apply a dry, sterile gauze dressing to a heavily exudating wound. E. Document the wound appearance, size, and drainage characteristics. F. Administer prescribed pain medication before wound care. Answer. Wear clean gloves for initial assessment and then sterile gloves for dressing application. Irrigate the wound with normal saline. Document the wound appearance, size, and drainage characteristics. Administer prescribed pain medication before wound care. This question focuses on correct practices for pressure injury wound care, emphasizing infection control, proper cleansing, and client comfort. Wearing clean gloves for assessment and sterile gloves for dressing ensures asepsis, while irrigating with normal saline effectively cleans the wound without damaging tissue. Administering pain medication beforehand enhances client comfort and cooperation. Thorough documentation of the wound's status is crucial for tracking healing progress. For example, before cleaning a sacral ulcer, the nurse would give pain meds, then use sterile technique to gently irrigate and dress it, noting all findings. Always prioritize infection prevention, gentle handling, and thorough documentation. Question 12. A client has a new prescription for Warfarin. Which client statements indicate a need for further teaching? Select all that apply. A. I will take my medication at the same time every day. B. I can still eat as much spinach as I want because it's healthy. C. I will report any unusual bruising or bleeding to my doctor. D. It's okay to take aspirin for my headaches as long as I don't take too much. E. I should get my blood checked regularly to make sure the medication is working. F. I will avoid drinking alcohol while on this medication. Answer. I can still eat as much spinach as I want because it's healthy. It's okay to take aspirin for my headaches as long as I don't take too much. This question tests understanding of critical client education for warfarin therapy, a potent anticoagulant. Warfarin efficacy is influenced by vitamin K intake, so clients must be taught to maintain a consistent dietary intake of vitamin K-rich foods like spinach, not to consume them freely or restrict them excessively. Additionally, aspirin increases the risk of bleeding when taken with warfarin, making its use contraindicated without medical consultation. For example, a client needs to know that sudden changes in diet or taking over-the-counter pain relievers can seriously impact their bleeding risk. Always emphasize consistency in diet and avoiding other blood-thinning medications when on warfarin. Question 13. The nurse is preparing to discharge a client who underwent a colostomy. Which instructions are essential to include in the discharge teaching? Select all that apply. A. How to empty and change the ostomy pouch. B. Signs and symptoms of stoma complications. C. Dietary modifications to manage gas and odor. D. Resuming normal strenuous activities immediately. E. Where to purchase ostomy supplies. F. Importance of maintaining skin integrity around the stoma. Answer. How to empty and change the ostomy pouch, signs and symptoms of stoma complications, dietary modifications to manage gas and odor, where to purchase ostomy supplies, importance of maintaining skin integrity around the stoma. This question addresses the comprehensive discharge education needed for a client with a new colostomy, focusing on self-management and preventing complications. Teaching includes practical skills like pouch management, identifying signs of stoma issues, e.g., color changes, prolapse, dietary adjustments to control common problems like gas, and knowing where to obtain supplies. Crucially, maintaining perianal skin integrity is vital to prevent irritation and breakdown. For instance, instructing a client how to properly cut the wafer to fit their stoma and avoid skin exposure is a key teaching point. The goal is to empower the client to confidently manage their new ostomy at home. Question 14. A client is receiving total parenteral nutrition, TPN. Which nursing actions are appropriate for the client's care? Select all that apply. A. Monitor blood glucose levels every 6 hours. B. Administer TPN through a peripheral 4-line. C. Change the TPN tubing every 72 hours. D. Weigh the client daily. E. Assess for signs of infection at the insertion site. F. Discontinue TPN abruptly if the client starts eating orally. Answer. Monitor blood glucose levels every 6 hours, weigh the client daily, assess for signs of infection at the insertion site. This question focuses on the essential nursing care for clients receiving total parenteral nutrition, a high-risk intervention. Due to the high glucose content, monitoring blood glucose every 6 hours is crucial to prevent hyperglycemia. Daily weighing helps assess fluid balance and nutritional status. Furthermore, meticulous assessment of the central line insertion site for signs of infection is paramount because TPN provides a rich medium for bacterial growth. For example, a nurse would check a client's fingerstick glucose, weigh them, and inspect their central line site meticulously each day to prevent complications. Remember to prioritize glucose control, fluid balance, and infection prevention with TPN. Question 15. The nurse is caring for a client with a urinary catheter. Which actions are appropriate to prevent a catheter-associated urinary tract infection, CAUTI? Select all that apply. A. Cleanse the perineal area with antiseptic solution daily. B. Ensure the drainage bag is kept above the level of the bladder. C. Secure the catheter tubing to the client's thigh. D. Empty the drainage bag when it is full. E. Perform catheter care after every bowel movement. Eve. Use sterile technique during catheter insertion. Answer. Cleanse the perineal area with antiseptic solution daily, secure the catheter tubing to the client's thigh, perform catheter care after every bowel movement, use sterile technique during catheter insertion. This question addresses critical nursing interventions aimed at preventing catheter-associated urinary tract infections, a common healthcare-associated infection. Using sterile technique during insertion minimizes microbial entry, cleansing the perineal area and performing catheter care after bowel movements reduce bacterial migration, and securing the catheter prevents urethral trauma and movement that could introduce bacteria. For instance, after a client has a bowel movement, the nurse would meticulously clean the area around the catheter and tubing. Always remember to maintain a closed, sterile system and meticulous hygiene to prevent CAUTI. Question 16. A nurse is providing education to a client about managing chronic pain. Which strategies should the nurse suggest? Select all that apply. A. Rely solely on opioid medications for pain relief. B. Practice relaxation techniques such as deep breathing. C. Participate in regular, gentle exercise as tolerated. D. Maintain a consistent sleep schedule. E. Apply heat or cold therapy as appropriate. F. Avoid social activities to focus on pain management. Answer. Practice relaxation techniques such as deep breathing, participate in regular, gentle exercise as tolerated, maintain a consistent sleep schedule, apply heat or cold therapy as appropriate. This question explores non-pharmacological and holistic strategies for chronic pain management, emphasizing client empowerment and multimodal approaches. Relaxation techniques like deep breathing help calm the nervous system, while gentle exercise can improve mobility and reduce stiffness. Maintaining a consistent sleep schedule promotes rest and restores energy, and applying heat or cold therapy offers localized symptomatic relief. For example, a client with chronic back pain might find gentle daily walks and a warm bath before bed significantly reduce their discomfort. Encourage clients to explore a variety of methods to find what works best for them, fostering an active role in their own care. Question 17. The nurse is assessing a client's peripheral circulation. Which findings indicate adequate peripheral perfusion? Select all that apply. A. Capillary refill less than 3 seconds. B. Absent pedal pulses. C. Warm, dry skin. D. Pale skin color. E. Strong, palpable pulses. F. Edema 3+. Answer. Capillary refill less than 3 seconds, warm, dry skin, strong, palpable pulses. This question assesses the nurse's ability to identify key indicators of adequate peripheral perfusion, which is essential for oxygen and nutrient delivery to tissues. Capillary refill less than 3 seconds signifies brisk blood flow, warm, dry skin suggests good circulation and hydration, and strong, palpable pulses confirm sufficient blood pressure and volume reaching the extremities. For example, a nurse checking a client's foot and finding it warm with a quick capillary refill and strong pulses confirms good blood flow. Always associate efficient circulation with warmth, normal color, and strong pulses. Question 18. A nurse is caring for a client experiencing acute delirium. Which nursing interventions are appropriate for this client? Select all that apply. A. Keep the client's room brightly lit with constant noise to provide stimulation. B. Reorient the client frequently to person, place, and time. C. Encourage family members to stay with the client if possible. D. Administer sedatives liberally to keep the client calm. E. Maintain a consistent daily routine. F. Provide a calm and quiet environment. Answer. Reorient the client frequently to person, place, and time. Encourage family members to stay with the client if possible. Maintain a consistent daily routine. Provide a calm and quiet environment. This question addresses therapeutic nursing interventions for clients experiencing acute delirium, focusing on promoting safety, orientation, and a stable environment. Frequent reorientation and encouraging family presence help anchor the client to reality, while maintaining a consistent routine and providing a calm, quiet environment minimize confusion and agitation. For example, explaining where they are and who the nurse is, and having a consistent meal and wake-up time, can help ground a client with delirium. Remember that the goal is to reduce environmental triggers and enhance cognitive function. Question 19. The nurse is preparing to administer medications through a gastrostomy tube. Which actions should the nurse take? Select all that apply. A. Crush all medications into a fine powder before mixing with water. B. Check gastric residual volume before administration. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Administer medications one at a time. E. Mix all medications together to save time. F. Elevate the head of the bed to at least 30 to 45 degrees. Answer. Check gastric residual volume before administration. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer medications one at a time. Elevate the head of the bed to at least 30 to 45 degrees. This question focuses on the correct procedure for administering medications via a gastrostomy tube, ensuring safety and efficacy. Checking gastric residual volume assesses stomach emptying and aspiration risk, while flushing before and after each medication prevents tube clogging and ensures full dose delivery. Administering medications one at a time prevents interactions and ensures individual absorption, and elevating the head of the bed minimizes aspiration risk. For example, a nurse would draw up each medication separately, check for residual, give one drug, flush, then repeat for the next, all while the client is sitting up. Always prioritize preventing aspiration and ensuring tube patency. Question 20. A nurse is assessing a client for signs of impending respiratory failure. Which findings would be concerning? Select all that apply. A. Respiratory rate of 12 breaths/minute. B. Use of accessory muscles for breathing. C. Restlessness and anxiety. D. Oxygen saturation, SpO2, of 98%. E. Paradoxical chest wall movement. F. Cyanosis. Answer. Use of accessory muscles for breathing, restlessness and anxiety, paradoxical chest wall movement, cyanosis. This question tests recognition of critical signs indicating impending respiratory failure, requiring immediate intervention. The use of accessory muscles signals increased work of breathing, restlessness, and anxiety are early signs of hypokalemia affecting the brain, and paradoxical chest wall movement indicates severe respiratory distress where the chest wall moves inward during inspiration. Cyanosis is a late and ominous sign of severe hypokalemia. For instance, a client with asthma who starts using their neck muscles to breathe and becomes agitated is showing concerning signs. Always remember that increased effort, mental status changes, and dusky skin are red flags for respiratory decline. Question 21. The nurse is providing discharge teaching for a client with heart failure. Which statements indicate effective teaching? Select all that apply. A. I will weigh myself every morning and report any sudden gain. B. I should avoid salty foods like processed meats and canned soups. C. If I feel short of breath, I should just lie down and rest. D. It's important for me to take my medications exactly as prescribed. E. I can drink as much water as I want to stay hydrated. Eve. I will try to remain physically active with regular walks. Answer. I will weigh myself every morning and report any sudden gain. I should avoid salty foods like processed meats and canned soups. It's important for me to take my medications exactly as prescribed. I will try to remain physically active with regular walks. This question assesses a client's understanding of self-management strategies for heart failure, a condition requiring careful lifestyle adjustments. Daily weighing and reporting sudden weight gain helps detect fluid retention early, while avoiding high-sodium foods is crucial to prevent fluid overload. Adhering to medication schedules is paramount for symptom control and disease progression, and engaging in regular, gentle physical activity improves cardiac function and overall well-being. For example, a client who understands to check their weight and avoid chips shows good comprehension of their condition. The core principle is proactive monitoring and adherence to a heart-healthy lifestyle. Question 22. A client is experiencing a febrile non-hemolytic transfusion reaction. Which nursing actions are appropriate? Select all that apply. A. Stop the blood transfusion immediately. B. Keep the 4-line open with normal saline at a slow rate. C. Administer prescribed antipyretics. D. Return the blood bag and tubing to the blood bank. E. Elevate the client's legs and administer oxygen. F. Document the reaction and interventions in the client's record. Answer. Stop the blood transfusion immediately. Keep the 4-line open with normal saline at a slow rate. Administer prescribed antipyretics. Document the reaction and interventions in the client's record. This question focuses on the immediate and appropriate nursing response to a febrile non-hemolytic transfusion reaction, a common but less severe reaction than hemolytic. The first action is always to stop the transfusion to prevent further reaction, but the 4-line should be kept open with normal saline to maintain venous access. Administering antipyretics helps manage the fever, and thorough documentation is essential for reporting and future client care. For example, if a client develops a fever and chills shortly after a transfusion starts, the nurse would stop the blood, run saline, give acetaminophen, and then chart everything. Remember, the priorities are to stop the exposure, manage symptoms, and document. Question 23. The nurse is teaching a client about self-monitoring blood glucose, SMBG. Which statements indicate effective teaching? Select all that apply. A. I should wash my hands with soap and water before testing. B. It's okay to reuse lancets multiple times to save money. C. I will record my blood glucose readings in a logbook. D. I should prick the side of my fingertip, not the center. E. I only need to test my blood sugar when I feel symptoms. F. I will check the expiration date of the test strips. Answer. I should wash my hands with soap and water before testing. I will record my blood glucose readings in a logbook. I should prick the side of my fingertip, not the center. I will check the expiration date of the test strips. This question assesses proper technique and understanding for self-monitoring blood glucose, a cornerstone of diabetes management. Washing hands removes contaminants that can skew results, recording readings helps track trends, and pricking the side of the fingertip is less painful due to fewer nerve endings. Checking test strip expiration ensures accuracy. For instance, a client who understands to clean their hands, use the side of their finger, and log the result daily demonstrates good self-care practice. Always emphasize clean technique, proper site selection, and consistent monitoring to ensure accurate and useful readings. Question 24. A client is experiencing an acute asthma exacerbation. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Bradycardia. B. Expiratory wheezing. C. Prolonged inspiration. D. Accessory muscle use. E. Dyspnea. F. Productive cough with thick, green sputum. Answer. Expiratory wheezing, accessory muscle use, dyspnea. This question focuses on identifying key signs of an acute asthma exacerbation, a sudden worsening of asthma symptoms. Characteristic findings include expiratory wheezing due to narrowed airways, the use of accessory muscles as the client struggles to breathe, and dyspnea, difficulty breathing. These symptoms reflect increased airway resistance and compromised gas exchange. For example, a child brought to the emergency department gasping for air and making a whistling sound when breathing out is likely having an asthma attack. Always associate asthma exacerbations with difficult exhaling, audible wheezes, and increased work of breathing. Question 25. The nurse is caring for a client with a new tracheostomy. Which nursing interventions are appropriate to maintain airway patency and prevent complications? Select all that apply. A. Perform tracheostomy care every 8 hours. B. Suction the tracheostomy tube routinely every 2 hours. C. Keep a spare tracheostomy tube of the same size at the bedside. D. Maintain proper cuff pressure for cuff tubes. E. Provide frequent oral hygiene. F. Change the tracheostomy ties daily. Answer. Perform tracheostomy care every 8 hours, keep a spare tracheostomy tube of the same size at the bedside, maintain proper cuff pressure for cuff tubes, provide frequent oral hygiene. This question highlights essential nursing interventions for a client with a new tracheostomy, focusing on maintaining a clear airway, preventing infection, and ensuring safety. Regular tracheostomy care prevents infection and skin breakdown, while keeping a spare tube at the bedside is a critical safety measure for accidental decannulation. Maintaining proper cuff pressure prevents tracheal damage and aspiration, and frequent oral hygiene reduces bacteria in the mouth that could lead to pneumonia. For example, after performing tracheostomy care, the nurse would ensure a backup tube is readily available in case of an emergency. Always prioritize airway security, infection prevention, and preparedness for complications. Question 26. A nurse is conducting discharge teaching for a client with a new prescription for a selective serotonin reuptake inhibitor, SSRI, antidepressant. Which information should the nurse include? Select all that apply. A. You may experience immediate relief from your symptoms within a few days. B. It's important to continue taking this medication even after you start feeling better. C. Avoid sudden discontinuation of the medication to prevent withdrawal symptoms. D. Report any increased agitation or suicidal thoughts to your provider. E. You should limit your intake of tyramine-rich foods. F. Common side effects include nausea, insomnia, and sexual dysfunction. Answer. It's important to continue taking this medication even after you start feeling better. Avoid sudden discontinuation of the medication to prevent withdrawal symptoms. Report any increased agitation or suicidal thoughts to your provider. Common side effects include nausea, insomnia, and sexual dysfunction. This question tests critical client education for SSRI antidepressants, focusing on therapeutic effects, adherence, and potential adverse effects. Clients must understand that SSRIs take several weeks to reach full therapeutic effect and should not be stopped abruptly to avoid withdrawal symptoms. Reporting increased agitation or suicidal thoughts is crucial, especially in the initial stages of treatment. Common side effects like nausea, insomnia, and sexual dysfunction should also be discussed. For example, a client needs to know that feeling better doesn't mean they're cured and should not stop taking their medication without consulting their doctor. Stress that consistency, patience, and open communication with the provider are key. Question 27. The nurse is assessing a client with tuberculosis. Which findings are consistent with this diagnosis? Select all that apply. A. Productive cough lasting longer than 3 weeks. B. Night sweats. C. Weight gain. D. Unexplained fever and chills. E. Homeostasis, coughing up blood. F. Headache and stiff neck. Answer. Productive cough lasting longer than 3 weeks, night sweats, unexplained fever and chills, homeostasis, coughing up blood. This question assesses recognition of the classic signs and symptoms of active tuberculosis, a highly contagious bacterial infection primarily affecting the lungs. Characteristic findings include a persistent productive cough for more than 3 weeks, drenching night sweats, unexplained low-grade fever and chills, and homeostasis, coughing up blood as the disease progresses and erodes lung tissue. For instance, a client with a history of exposure who presents with these persistent symptoms would warrant further diagnostic testing for TB. Remember that TB symptoms are often chronic and systemic, reflecting the body's ongoing fight against the infection. Question 28. A nurse is providing education to a client on fall prevention in the home. Which instructions should the nurse include? Select all that apply. A. Keep pathways clear of clutter and throw rugs. B. Install grab bars in the bathroom near the toilet and shower. C. Use dim lighting in hallways at night to promote sleep. D. Wear non-slip footwear, even indoors. E. Leave cords coiled on the floor to keep them out of the way. F. Ensure adequate lighting in all rooms, especially stairwells. Answer. Keep pathways clear of clutter and throw rugs. Install grab bars in the bathroom near the toilet and shower. Wear non-slip footwear, even indoors. Ensure adequate lighting in all rooms, especially stairwells. This question focuses on practical, evidence-based interventions for fall prevention in the home, crucial for elderly clients or those with mobility issues. Removing clutter and throw rugs eliminates tripping hazards. Installing grab bars provides support in high-risk areas like bathrooms, and wearing non-slip footwear improves traction. Ensuring adequate lighting, especially in transitional areas like stairwells, enhances visibility. For example, advising a client to remove that small rug by their bed and add a night light can significantly reduce their fall risk. Think about how to make the environment safer and easier to navigate for someone with balance or vision challenges. Question 29. The nurse is caring for a client with a newly inserted peripherally inserted central catheter, PIC. Which actions are appropriate for the nurse to take? Select all that apply. A. Obtain a chest X-ray to confirm placement before use. B. Monitor for signs of infection at the insertion site. C. Perform dressing changes using sterile technique. D. Administer all 4 fluids through this line, regardless of compatibility. E. Flush the PICC line with heparin or saline per protocol. F. Use the PICC line for blood pressure readings. Answer. Obtain a chest X-ray to confirm placement before use, monitor for signs of infection at the insertion site, perform dressing changes using sterile technique, flush the PICC line with heparin or saline per protocol. This question addresses the essential nursing care for a client with a new PICC line, a central venous access device. Confirmation of placement by chest X-ray is mandatory before initial use to prevent serious complications. Meticulous monitoring for infection, performing dressing changes with sterile technique, and flushing the line per protocol are crucial to maintain patency and prevent infection. For example, before using a newly placed PICC, the nurse must ensure the X-ray report confirms tip location. Always prioritize verifying placement and maintaining strict asepsis to prevent complications with central lines. Question 30. A client with diabetes mellitus is experiencing hypoglycemia. Which signs and symptoms would the nurse expect to observe? Select all that apply. A. Hot, dry skin. B. Shakiness and tremors. C. Sweating. D. Bradycardia. E. Confusion and irritability. F. Hunger. Answer. Shakiness and tremors, sweating, confusion and irritability, hunger. This question assesses the recognition of classic signs and symptoms of hypoglycemia, a dangerously low blood glucose level. Characteristic findings include shakiness and tremors, sweating due to sympathetic nervous system activation, confusion and irritability from glucose deprivation to the brain, and intense hunger. These are the body's immediate responses to a lack of energy. For example, a client who suddenly becomes disoriented, starts sweating, and complains of feeling ravenous is likely experiencing hypoglycemia. Remember to think cold and clammy, need some candy as a quick reminder for hypoglycemia. Question 31. The nurse is administering a subcutaneous injection. Which actions are appropriate? Select all that apply. A. Select a 25 to 27 gauge needle, 1/2 to 5/8 inch in length. B. Insert the needle at a 45 to 90 degree angle. C. Aspirate for blood return before injecting the medication. D. Inject the medication slowly. E. Massage the injection site vigorously after administration. F. Rotate injection sites to prevent tissue damage. Answer. Select a 25 to 27 gauge needle, 1/2 to 5/8 inch in length. Insert the needle at a 45 to 90 degree angle. Inject the medication slowly. Rotate injection sites to prevent tissue damage. This question focuses on the correct technique for administering a subcutaneous injection, ensuring proper drug delivery and minimizing client discomfort. Using a small gauge, short needle and inserting at a 45 to 90 degree angle ensures the medication reaches the subcutaneous tissue. Injecting slowly reduces pain and allows for better absorption, and rotating injection sites prevents lipodystrophy or tissue damage. For example, when administering insulin, the nurse would use a fine needle, pinch the skin, inject at a 90 degree angle for adequate fat, and encourage the client to use different sites daily. Always prioritize correct needle size, angle, and site rotation for subcutaneous injections. Question 32. A nurse is providing care for a client in buccal traction. Which nursing interventions are appropriate? Select all that apply. A. Ensure the weights hang freely and do not touch the floor. B. Remove the traction weights to assist the client with repositioning. C. Assess skin integrity under the traction boot or straps. D. Provide regular pain medication as prescribed. E. Elevate the head of the bed to a high Fowler's position. F. Perform neurovascular checks on the affected extremity. Answer. Ensure the weights hang freely and do not touch the floor. Assess skin integrity under the traction boot or straps. Provide regular pain medication as prescribed. Perform neurovascular checks on the affected extremity. This question addresses the essential nursing care for a client in buccal traction, which aims to immobilize and reduce muscle spasms. Ensuring weights hang freely maintains continuous traction, while meticulous assessment of skin integrity prevents pressure injuries under the boot or straps. Providing pain medication as prescribed ensures comfort, and performing frequent neurovascular checks is crucial to monitor for circulation, sensation, and movement impairment. For example, the nurse would check the client's foot for color, warmth, and movement hourly, making sure the weights are never resting on the bed. Remember, constant tension and vigilant monitoring of the extremity are key with traction. Question 33. The nurse is assessing a client for signs of impending cardiogenic shock. Which findings would be concerning? Select all that apply. A. Bounding peripheral pulses. B. Hypotension. C. Tachycardia. D. Cool, clammy skin. E. Increased urine output. F. Decreased level of consciousness. Answer. Hypotension, tachycardia, cool, clammy skin, decreased level of consciousness. This question tests recognition of the critical signs of impending cardiogenic shock, a life-threatening condition where the heart cannot pump enough blood to meet the body's needs. Key indicators include hypotension due to decreased cardiac output, compensatory tachycardia as the heart tries to maintain perfusion, cool and clammy skin from peripheral vasoconstriction, and a decreased level of consciousness due to reduced cerebral perfusion. For instance, a client with a large myocardial infarction who then becomes hypotensive and confused is showing signs of cardiogenic shock. Always associate cardiogenic shock with a failing pump leading to low blood pressure and poor organ perfusion. Question 34. A nurse is preparing to administer immunizations to a child. Which actions are appropriate prior to administration? Select all that apply. A. Obtain informed consent from the parent or legal guardian. B. Ask the parent about any allergies, especially to vaccine components. C. Administer the vaccine without checking the child's immunization record. D. Provide the vaccine information statement, VIS, to the parent. E. Reassure the parent that no side effects are expected. F. Assess for any contraindications to vaccine administration. Answer. Obtain informed consent from the parent or legal guardian, ask the parent about any allergies, especially to vaccine components, provide the vaccine information statement, VIS, to the parent, assess for any contraindications to vaccine administration. This question focuses on essential pre-administration actions for immunizations, ensuring safety and legal compliance. Obtaining informed consent and providing the vaccine information statement, VIS, are legal requirements, informing parents of risks and benefits. Assessing for allergies to vaccine components and contraindications ensures client safety and prevents adverse reactions. For example, before giving a tetanus shot, the nurse would get consent, give the VIS, and ask about severe egg allergies or previous reactions to vaccines. Always prioritize informed consent, client safety screening, and providing comprehensive information. Question 35. The nurse is caring for a client with AC, difficile infection. Which infection control measures are appropriate? Select all that apply. A. Place the client in a private room. B. Use an alcohol-based hand rub before and after client care. C. Wear a gown and gloves when entering the client's room. D. Clean contaminated surfaces with a bleach-based solution. E. Use a dedicated stethoscope and blood pressure cuff for the client. F. Ensure visitors wear a surgical mask when in the room. Answer. Place the client in a private room, wear a gown and gloves when entering the client's room, clean contaminated surfaces with a bleach-based solution, use a dedicated stethoscope and blood pressure cuff for the client. This question addresses specific infection control measures for Clostridioides difficile, C. difficile, a highly contagious, spore-forming bacterium. C. difficile requires contact precautions, including a private room, wearing a gown and gloves for all interactions, and using dedicated client equipment to prevent cross-contamination. Crucially, surfaces must be cleaned with a bleach-based solution as alcohol-based hand rubs are ineffective against C. difficile spores. For instance, a nurse would ensure a client with C. difficile is in a single room, wear full PPE, and use only equipment designated for that client. Always remember that C. difficile demands stringent contact precautions and spore-killing disinfectants.